Hello and welcome to Checking the Vitals, a podcast powered by SpecialtyCare. I'm Todd Schlosser, and today our guest is Dr. Paonessa, an orthopedic spine surgeon at Orthopedic Partners in Connecticut. In this conversation, we discuss how a meeting with some of his high school mentors led him to enroll in medical school, how orthopedic surgery has changed over the course of his 30-year career, and we also discuss the mission work that he is doing in Africa, Jamaica, and the Philippines. Enjoy the conversation. So, Dr. Paonessa, thank you so much for joining us. I like to start out all of these podcasts by trying to find out why you decided to go into healthcare. So is there something that sort of inspired you to go into that field?
You know, it's interesting. When I was in grammar school and high school, I was very athletic. I did all was the typical three sports. I did basketball, baseball and football.
Yeah.
And unfortunately, I got hurt a lot of times. And,
As happens, yeah.
It happens. So I had a couple of sports injuries when I was in high school that I ended up going to a orthopedic doctor that was in our town and ended up, at that time being impressed by, this gentleman seemed very caring and, had a very good demeanor, was very good with patients. And then actually, when I started college, my brother-in-law had been a sociologist, a social worker.
Yeah.
So my brother-in-law kind of talked me into going and starting in sociology. So I was one of these people that I started as one major. I started as a sociology major, and then ended up graduating college with a double major. I had changed to psychology and to biology.
So you had the sort of a bioscience degree and a psychology degree. When did you decide, or was it during that time that you decided you wanted to be a doctor?
I actually didn't decide that I wanted to go to medical school till my last year of college.
Oh, okay.
So there was a pre-professional committee you had to go to get a letter of reference.
Yeah.
And it was interesting. I was actually going to apply for to become an optician. I guess one of these people who examine your eyes, make glasses. And I was in front of this committee, and as I was explaining what I wanted to do, they just said, stop. Says, you're going to be valedictorian. We think you really should do something bigger, something better. And I was like, how can I go to medical school? My father's a carpenter. How am I going to afford it? And the professor of chemistry said to me, Ken, there's something called a loan. You'll take a long, long time to pay it off, but it can get you to go to school.
Yeah.
And I was like, wow, that's really interesting, because I was like the only second person in my extended family to go to college, let alone professional school. So I really didn't have anybody as a role model.
Sure.
But I decided to go to medical school after having this committee kind of tell me they wanted me to go to medical school.
Yeah. Well, that's got to be a nice sort of validating moment for you when people who you've seen as, mentors and teachers or professors are like, hey, you can do more than just that.
Yeah.
That's got to be a nice moment for you. So when did you sit down and decide where you wanted to go to medical school? And then where did you end up?
I grew up in northern New Jersey, so I applied really all over the East Coast. At that time, I was starting to date a woman who turned out to be my wife for the last 37 years. So she was working in New York, so we were really looking to try to stay in the New York, New Jersey area. So I ended up getting accepted to medical school in Newark, New Jersey.
So you finished medical school, I think, in the late 80s?
Yeah, I finished medical school in 1984.
Okay, so mid-80s. And then you did your residency. Where did you end up with your residency?
So I did my residency also in New Jersey. It was part of Seton Hall University. It was at St. Joseph's Hospital, which is in Paterson, New Jersey.
So when you went to med school, did you decide at that point you wanted to do orthopedics? Or when did you decide you wanted to do that?
I decided probably about the end of my third year of medical school.
Okay.
At that point, how our medical school was, at that point you did general surgery, you did like a rotation between surgery, medicine, pediatrics, OBGYN, something else as a third year student. And the people that I had worked with, I spent 2 weeks on an orthopedic rotation, and they just really seemed to have a lot of fun. They liked what they were doing. You could see the patients, even in 2 weeks, you could see some of the patients that you had operated on Monday the first week. By Friday the second week, we're starting to get ready to go home, get better. So I really liked that concept of helping younger people, or even middle-aged people get better. I mean, I saw a couple of knee and hip replacements, and just watching these people that could barely walk, and then all of a sudden be able to start to walk, I thought was really rewarding.
Yeah, orthopedic surgery is interesting in that way because if you're to the point where you need surgery, because a lot of times, even doctors in your situation who are surgeons will try and do everything else except for surgery before, like rehabilitation or injections or things like that, to get people manageable. Because it's all about living that sort of life balance, right? But if surgery is your option, it's interesting that with orthopedic surgery, it's not immediate, but it's very quick. You'll start to see the impact of what you've done.
Yeah, that was very noticeable right from the beginning.
Yeah.
The other part I liked was, in many ways, as an orthopedic surgeon, you could treat people really from birth to when they die. I mean, even in my practice now, I have patients where I'll see people under 9, 10 years old, pediatric patients, and then I'll see a 90-year-old in the other room. So it's like, even now in my own practice, I have a very varied practice that way.
Yeah. Actually, I'd like to ask you about that, because the age range of your patients is so large. Are there typical diagnoses for people at certain aspects or certain places in their life? Do you see a lot of injuries in that 15 to 25 age, where it's like sports injuries or things like that, and maybe more of like the osteoporosis towards the end of life? Or does it sort of run the gamut? Anybody can sort of have anything?
No, definitely. As you look at the parts of aging, there are definite different diagnoses in younger pediatric patients, and then different diagnoses you see in the say 20 to 30-year-old, the millennials at this point. And then definitely, I see a lot of patients that are older adults, and I mean, one of the things I'm pretty passionate about is getting them evaluated for osteoporosis and things like that. So, the nice thing about being in a private practice where I'm not pigeonholed into that I've only got to do one specialty, that's one of the things that I like about it. I know some professors, when you go to a bigger university setting, I mean, you'll have a professor that only does one particular thing, but they don't have any exposure to the other parts of it. So, I kind of like the way that my practice has evolved that way.
Yeah. So when you finished your residency, did you go immediately into private practice?
No, orthopedic residency is typically 5 years. So at the time when I was finishing in 1989, probably about a third of the people graduating would do an extra year or two of training. That's really changed. I mean, now almost about 90% of the people that finish their training go on to like a real subspecialty, a fellowship. So at the time when I was deciding, I really enjoyed spine surgery. Had a couple of mentors in my residency that were very active with spine surgery. So I ended up deciding I wanted to do a fellowship and really specialize in spine. And at that time, I was looking to also be able to get a well-rounded training so that you'd get treatment for children, middle-aged adults and older adults. So I tried to look for a training program that would have that. Yeah.
So I guess you finished that fellowship around when? Or was that?
So I did a 1-year fellowship.
Okay,
and
so 90.
At that time, again, my wife and I were living in the New York, New Jersey area. So I did it at NYU, which was interesting because the 3 hospitals I trained at for that year, there was the NYU, which is, they have like a university hospital on First Avenue in New York, and then block down was Bellevue, which is the big city Hospital, and then 2 blocks down lower was the Manhattan VA.
Yeah.
So, I used to like do rounds, walking from one hospital to the other. But it was a very good training program. I did actually. There were like 6 people I trained with. There were like 3 orthopedic surgeons and 3 neurosurgeons. So I got a really pretty good amount of different experiences.
Yeah. So you finished that in early 90s, very early 90s?
1990, yes.
Oh, okay, so exactly 90. And then did you immediately go into private practice?
Yes. At that point, I looked around and I was looking for a practice that I felt I could grow into and they could grow with me. So actually, the group that I'm with now, I joined them in 1990.
Okay, so you've been practicing for almost, 30 years?
29 and a half years.
Yeah, so close to 30 years. So have there been significant changes in how the surgeries are performed or techniques that are used in those 30 years?
I mean, there's always improvements in the techniques of how we do these things.
Sure.
And some of that is the actual equipment has changed dramatically. I mean, just in terms of the equipment of how we, attach metal rods to the spine or what we do, to correct the deformities, that's really changed dramatically.
Yeah.
I mean, the other thing that's very interesting is like when I first started into my practice, as I said, I was doing a fellowship, but a lot of other people that were joining the group were just doing general orthopedics. So when I started, I had I was the first one in this group to do a fellowship. And then gradually, now almost every person that we have join our group has a fellowship. So the concept of being really like in one area has become, more widespread. I mean, in our group now we have people with every specialty really.
Sure. Yeah.
Whereas when I first trained, first came into practice, I really would have, I didn't do any hip replacements or knee replacements, but I really did every fracture that came in.
Sure.
And every, so I did a lot different things then, but it's very hard to stay up to date with all this.
Yeah. I was going to ask what the benefits of that hyper-focusing of, the skill set, right? Because you go to residency to decide or go to residency to practice the kind of doctor you want to be. And then a lot of people go to a fellowship to even sort of hyper-focus on the type of surgery within that specialty. So what's the benefit of getting hyper-focused on spine or ankles or whatever you're focusing on?
Well, I think, in terms of getting like super specialized, you definitely, if you're going to somebody with that type of training, like spine surgery, you really, it's hard to go to and see somebody who would be doing a spine surgery one day and a hip replacement the next day.
Sure.
I mean, it's just very hard for that doctor to know all of the latest knowledge, be able to be up on all the procedures, what are the improvements from year to year.
Right.
So I think in some ways you do need to see somebody that's like kind of specialized. As I was saying, the one thing I like with my practice as I've grown it is I'm specialized in spine. Really, that's like 95% of what I do. But the group of what I do goes the gamut from a young child to an older adult.
Yeah.
And a lot of other people, people in different different practices that they don't do that. They'll just do adults or they'll just do children. Whereas I kind of like the idea that I do a little bit of all of it.
Yeah. So you've been practicing for about 30 years, and we've talked a little bit about like how techniques have changed and technology has changed to make surgery safer and make practicing safer. Are there innovations that are coming that you're looking forward to, or advancements that you think are just around the corner in your field?
Well, when I go to meetings every year, there always are the papers that get discussed that are talking about new technologies and new things like that. So there are a lot of, especially for scoliosis and in general spine surgeries, there's a lot more things that are being done with robotics, being able to put some of the equipment in, using some other type of technology to help the surgeon. So that's been really interesting. I mean, probably about 3/4 of the, just one thing like what we call pedicle screws, which is when you're putting a screw into a bone in the spine. I mean, we used to do it with X-ray, and then we went to like fluoroscopy, and then now we do it with these robots. And there is a definite technology kind of, you couldn't have thought about doing that 30 years ago.
Right.
So that's exciting, seeing things like that, and just some of the more minimally invasive procedures. There's a lot more push to that. So there's a lot on the horizon. I mean, what it'll be in another 30 years, who knows?
Sure.
It'll be somebody else that'll be doing that. I'll be retired by then. But it's certainly interesting keeping up on all of this.
Absolutely. So I also saw online that you've done quite a bit of mission work, sort of going and offering your services to less advantaged areas. So how did you get involved in doing that?
Probably almost about 19, 20 years ago, I met a doctor through one of our professional organizations. His name was Ohanaba Bawachi. And Dr. Bawachi was originally from Ghana in West Africa, came to the United States, trained, was a very well recognized scoliosis surgeon in New York City. I didn't actually train with him, but we were he's a little bit older than me, so he's kind of a mentor. So I met him through one of our professional organizations, Scoliosis Research Society, and he had started doing trips going back to his country that was his birth country in West Africa to do surgery. And I started to become aware, and through him, the discrepancy of, in the civilized world versus the developing world, just the discrepancy of how many doctors there are for somebody who needs treatment. I mean, scoliosis is one of my passions.
Sure.
And, it affects maybe 2 or 3 people out of 1,000 who, get bad curvatures of their spine that they're really deformed. And that can affect their breathing, and it could affect their nerves. I mean, they could really have a miserable life if they can't stand up straight.
Yeah, absolutely.
So in a place like New York City, there could be close to 100 people for, say, 8 million people.
Sure.
So there could be 100 people that could treat that condition. Country like Ethiopia, which has about 50 million people, there are 0. There's no person in that country that is trained to treat that. And other countries in West Africa, East Africa, Asia, really even in South America, I mean, many of these countries, there's nobody to treat that. So, I mean, I was a parent at that point. I had 3 children. And I'm thinking, I'm so lucky that I'm in a country where if one of my children got this type of a disease, they would have, here in Connecticut, they'd have probably a dozen people they could go to. Connecticut's a small state.
Yeah.
But in if they were born in some other circumstance, someplace else in the world, they'd have no chance to be able to have that surgery. So Dr. Bawachi asked me to if I was interested in going, and he had started working with a local hospital, and then he actually ended up building his own hospital. Wow. In Ghana. And so I started volunteering with him. So I must have done about 15 trips to Africa, to Ghana in West Africa and to Ethiopia in East Africa. So I'd done about 15 trips going there, seeing the children, doing surgeries, and helping out with the care, for these children. And and because I am being in Connecticut and he's in New York, I used to go down there and kind of help him. We'd go through the X-rays, kind of help plan out like who was going to get operated on the trips.
Before you even go on the trip.
Yeah, so there's a lot of planning. And with Dr. Bawachi, where we used to go in Ghana, he would work with the local surgeons. He was training the local surgeons how to do these. So you're really trying to do that adage of, if you just give a man a fish, you don't help him that much. Yeah. But if you teach him how to fish,
he can fix all the spines in the country.
He can fix all the spines in the country. Yeah. So Dr. Bawachi had that, passion. So I had been doing this for almost about 10 years, and the professional organization that he and I were a member of, I had volunteered to be a coordinator of a committee, and this committee is basically for global outreach. So I was the chairperson of this committee, and Dr. Boachi had been approached by Duncan, and Wida was a person in New York City who was from Jamaica and wanted to start doing some type of care for children in Jamaica. And the organization had actually started with doing, the Duncan Tree organization had started in New York doing other types of care, but she had been asked to try to help for spine surgery.
Sure.
So Dr. Boachi kind of connected me with Wida and said, Ken, I think you're ready to kind of make a jump to be, go from just being a helper to being
the lead guy,
the lead person.
Sure.
Yeah. So so he introduced me to Wida at that point, and that began the next part of my journey to volunteering.
So, and that's sort of how you ended up doing these mission trips to Jamaica?
Yes.
Does Duncan Tree, the Duncan Tree Foundation, does it go other places than Jamaica, or is it?
Yeah, right now we have 2 trips a year to Jamaica, and those have been going on since 2012.
Oh, wow.
And then we do 1 trip a year to the Philippines.
Okay.
So we ended up starting to go to the southern Philippines, and hopefully this coming year in 2020, we're going to actually do 2 trips, do 1 to southern Philippines and 1 to northern Philippines.
Awesome. So a lot like with Dr. Boachi, when he went to Ghana, he was also sort of working with the surgeons that were there, and it's almost a training mission as much as it is to help the people who actually need the surgery. Correct? Is it that same sort of mission in Jamaica and the Philippines?
Yes. I mean, what ends up happening, in a lot of these developing countries, they have doctors who sometimes are trained to do the surgeries, but one of the problems with these smaller, third world countries, they can't afford any of the implants, and the implants are very expensive.
Yeah.
So what the country may provide is the person could go to the hospital, they could have surgery, they could stay in the hospital as long as they want, but the government can't afford the implants. The other thing that in many of these countries they can't do is what's called spinal cord monitoring. That when you're taking a spine that's crooked and trying to straighten it out, you're stretching the nerves.
Yeah.
And if you try to do that without any way of monitoring the nerves, unfortunately, in some cases you could make the spine straight, but you have stretched the nerve so much that the person can be weak in their legs or actually be paralyzed.
Yeah, a negative outcome of some sort.
Yeah. So what we've also partnered with is an organization to bring people who can do spinal cord monitoring with us, which is really very, very helpful.
Yeah.
And then we also have partnered with a couple of the equipment companies. And the equipment companies, as part of their philanthropic missions, will donate equipment.
Yeah.
And so what we have to do is coordinate the trip of, bringing the doctors, the nurses, the spinal cord monitoring techs, and the equipment, and have it show up, to the country.
Yeah. You mentioned you bring a spinal monitoring technician or a neurophysiologist, or
Yes.
You bring that team with you. Do you bring a whole team with you, or is it just that one member of the team that then plugs into the teams they have there in Jamaica or the Philippines?
Well, what happens is when we have a trip, and I'll just give it like an example of an average trip. An average trip, say to Jamaica, will go for a week, and usually I try to have I'll go and I'll usually try to bring 1 or 2 other surgeons from my friends, colleagues, whoever I can get who's a spine surgeon who is interested in going.
Sure, yeah.
And most of them are attendings, but sometimes they're doctors in training too that'll come with us. And then normally we bring 2 spinal cord monitoring technicians, because we normally have at least 2 operating rooms going at a time. So you need 1 tech for each room.
Because I'd imagine you're trying to do as many surgeries as possible while you're in country.
Yes, exactly.
Yeah.
And then normally the equipment companies will have 2 equipment technicians or representatives come, and they're there to clean the equipment, make sure it's all in working order. And when they bring these, we call them bins. I mean, basically imagine a big packing crate that's, like what you would carry.
Yeah.
I mean, there may be 20 of them.
Oh, wow.
Full of equipment and screws, rods,
Sure.
hooks, all kinds of things. So it's a lot to get through customs.
I'm sure.
And then we also try to bring, if we can, like 1 or 2 nurses, and we sometimes bring photographers on the trips with us and other people,
Sure.
research people. So it really is like an entourage of people. But when we get there, we definitely work with the local people. It's not like we're just coming in and taking over the whole hospital.
Right.
I mean, one of the biggest things is training the local staff. And, we usually do a lecture series.
Awesome.
A lot of times if I'm bringing someone that's a colleague of mine from who they'll also do like a grand rounds, do teaching to the residents. And we're always trying to work and teach the residents. And in Jamaica, there's a team of people that we work with, and the hospital that we go to is Kingston Public Hospital.
Sure.
Which was founded in 1776.
Wow.
And some of the buildings look like they were still there from then. But really the staff are wonderful. And then the same in the Philippines. We work with, the local residents and the doctors there.
So you've been doing this mission work for about 2 decades?
I started 2003.
Okay, so coming up on like 17 years or so. And is all that work, is that what led you to receiving the Walter P. Blount Humanitarian Award?
Yes, I mean the Scoliosis Research Society, which I'm a member of, and which is where I met Dr. Boachi. They have a Humanitarian of the Year award, and I was very, very blessed to receive that 3 years ago.
Excellent.
And that was, for a combination of the volunteer work I did with Dr. Boachi, and then now the volunteer work I'm doing with Duncan Tree Foundation.
Yeah.
And as I had said before, I'm also been very involved in the committee that they have for trying to encourage people to do global outreach.
Yeah, absolutely. It's a huge need. I mean, in a perfect world, we wouldn't need to do that, but we don't live in that perfect world. So it's great that there are doctors that are willing to give up, their time and resources to get there and all that stuff to make it happen.
When I get asked by people, why do I do this? And, it obviously, it's a very difficult decision for somebody to do this because, a lot of times you're as a physician, we're traveling outside of our envelope that we're comfortable with.
Sure.
That you're kind of going to a country that you don't know their medical system. You're going to a country where they may not have all your favorite instruments. And can you operate with, some borrowed instruments? And, and you're doing surgeries that have been, on patients who have been neglected. Some of them have been waiting 8 or 10 years for somebody to come and fix this. So that you're fixing deformities that are much, much, much worse than anything I would typically see here in, the United States. But the thing is, you come out of it, and I feel like I'm a better surgeon for my patients here in the United States. It gives you this warm, fuzzy feeling, just helping people. But I've just developed wonderful friendships. I mean, when I go, to meetings, I mean, I can count as friends of mine people from 20 or 30 different countries that I've met through these trips or trained with them or worked with them. And it really does show that, every ounce of volunteering I do, I get 3 ounces of something good in return.
Yeah.
Absolutely. That way.
So if there's a way someone wants to get involved with, say, Duncan Tree or the Duncan Tree Foundation, is there a way they can reach out to the foundation?
Yes. I mean, the foundation, I'm involved in the foundation. I'm the vice president of the foundation with Weta Duncan. The Duncan Tree Foundation has a website. We also are on Facebook, on Twitter. So if people, we try to be as connected as we can.
Sure.
But definitely we are always looking for volunteers. We're always looking for people, even if they're not a volunteer in the medical field, if they're a volunteer in advertising or volunteer in anything else. I mean, keeping a volunteer organization means, you really do need people to do other things.
Sure.
To get the equipment. I mean, we have people who all they do is call for the equipment companies to get, the services for what we need to bring over there.
Sure.
So if people are interested, I've had medical students come on our trips. We've had college students who have volunteered. We could always find people something to do.
Awesome. So is there a specific website they should go to look into doing that?
Yes. We do have a website for the organization, which is duncantreefoundation.org.
Excellent. Awesome. So I did want to close with a final question. Since you've been in practice for almost 30 years and you've done a lot of this, what I would call fellowship work, although in your community, fellowship means something very specific, but I guess more mission work. Is there advice that you pass on to people that maybe look to you as a mentor, that are maybe thinking about getting into the field or have been in the field or just started into the field?
Well, I mean, at this point, after 30 years, I hope that I can impart some wisdom to, people that are looking at both orthopedics and spine surgery and volunteering. I mean,
Sure.
I think those are the three things that I can help. I mean, and really orthopedics is a great field. I think as we all age, the baby boomers are going to need to get fixed as they get older.
Sure.
Orthopedics is a great field. Spine surgery I find very rewarding, and volunteering, there's always room for people to volunteer. And, I'm involved with my professional organizations on trying to, help mentor people that are looking to do volunteer sites and kind of how to get them started.
Excellent. Well, Dr. Paonessa, thank you so much for joining us here on the podcast. We appreciate it.
Thank you for having me.
Absolutely.
It's been a pleasure.
Thanks.